Warning, listening to this show may result in increased levels of inspiration, motivation, and innovation. Side effects can include the immediate urge to take massive action to build a better business and life for yourself and others. You've been warned. Welcome to Influencers Radio with your host, Jack Mize.
And welcome back to another episode of Influencers Radio. Today, we are going to be talking about workplace, those extra benefits and those things that show that companies care. And what you may be thinking right now is about, the 401k plans, the helping me build wealth, those wealth management. That's what everybody looks at, in the years of pensions and 401ks and all kind of, employer retirement plans. But today, my guess, she helps large employers and health plans, develop health management. All right. It's health management. She spent the last 20 years in corporate wellness and health management programs. And what you may be thinking is, I've seen, the wellness programs and health fairs come through, my company, but it goes much, much deeper than this. And what she's doing is actually creating what she calls a culture of health within these employers. And after I looked at this and seen what she's doing and the results that she's producing, it really is remarkable and definitely ties to the bottom line of not just the companies, but also the employees. So today I'd like to welcome my guest to Influencers Radio, Hayley Hines. Hayley, how are you doing?
Good, Jack. Thanks for having me.
Well, I'm glad to have you. And one of the reasons is because, one, you've been in this for 20 years, corporate wellness and health management, and you've probably seen a dramatic shift in what's happened, over those 20 years because, I can remember 20 years ago, and I bet it even to today, people think, a health program, let's throw a Stairmaster in the empty, room, and that's our company health club. But companies are starting to realize this isn't just like an extra perk for employees. They're actually seeing that it affects their bottom line financially and not just saves them money, but can actually improve their bottom line and help them grow and profit. And one of the ways you've been doing this is creating this culture of health. So let's start right there. What is the culture of health?
Sure. It has changed and evolved over the last several years. And really, when we talk about creating a culture of health, it's essentially saying from the top down, from the senior leadership all the way down throughout an organization, that is what they're about. They're about healthy living. All of the policies and decisions kind of come into alignment around making sure that their population creates a healthy lifestyle. So that's part of what we do is help really identify what those elements are within an organization and then help them create that sustainable behavior change.
So,
including not just the treadmills, but also the food that they order and all of those different elements as well.
Right. And so it's not just physical or saying, hey, accounting, we need to let them out and do a setup every now and then, right? They're not getting enough. It's actually a full package, but it's not necessarily, because I think when a lot of people think about this, it's like, we don't allow them to smoke anymore. Right. And, we don't want to be like the kids. We're not going to monitor their cafeteria habits. Right. But it's kind of what they provide and the little things, does it start all the way down to, the donuts in the break room in the morning
Absolutely.
Yeah. So what does that look like?
So essentially it's making, healthy choices available. For example, during the lunch times, do they have healthy menus? Do they bring in, platters of pasta and lasagna for company meetings, or they do lighter options? Do they have the stairwell so people can take the stairs up and down? Do they have access to a fitness center or walking path? Do they have maybe offer yoga or some kind of stress management intervention on site? Do they offer discounts for a health club, or do they provide any kind of incentives for their employees to be active? We've got a lot of folks now that wear some of these wearable devices, and we've got all this data and information that we can integrate in to create incentives for employees to actually be healthy and move more. So we've seen kind of the whole spectrum that is included to help in any possible way to create a better lifestyle for that employee.
Yeah, and one of the things that I liked about this, because at first when I started reading about this and seeing it, I was thinking more like, oh, this is boot camp. It's, what are we taking away from people as far as taking away what they're eating or making them, you see some of these shows, news show, like from Japan, where in the morning it's, you get here early because we're all going to do jumping jacks and set up. And really what you've done is not about taking away. It's not restricting or taking away people's rights or what's available to them. It's actually adding to what's available to them to be able to give them healthy choices. So I think there's an important distinction that it's not about, being regimented and no, we're only, you can only have fruit and you can't have the donuts. You can't have this. You're just saying that, no, let's make it easily available to them to be able to do this.
Because it is hard to make choices that way. So we try to make it as easy as possible.
Yeah, and I think a lot of people would do that. They would go for the orange instead of the donut if it was just there, right? But it's not.
Right, absolutely.
But when it's not just about getting on the treadmill. When you talk about the yoga and things like that, and even offering discounts at health clubs. These are things that it seems like it's pretty easy for just about any type of employer to do. It's not about, let's find, 10,000 square feet of space and build a gym on campus. It's other things that they can do. What are some of those things that are not necessarily invasive or maybe require a huge budget to implement that they can do, to start developing this culture?
Yeah. So a couple of things that are really, really easy and I've seen be very successful is one of the things you mentioned, fruit, right? So obviously we know that an increase in fruit and vegetable intake is beneficial for a lot of different reasons. I've had employers that'll just simply start offering fruit delivery, free delivery of fruit, and people go crazy with it. And it ends up makes just it a lot easier for them to eat more fruits during the day. So things that are really, really simple, like I said, offering the ability to take the stairs instead of the elevator, or have walking meetings. We also see a lot more employers offering a standing work desk that you can sit or stand, which makes it a really nice way for employees to be a little more active and move a little bit more. And those aren't necessarily that expensive either. There's also a lot of other offerings around, health coaching and kind of really digging into more specific condition type things, either weight management programs, health coaching made available, tobacco cessation initiatives that employers can utilize that really can help support the employee no matter where they are in the health spectrum and no matter where they are in terms of what they want to work on. You and I probably have very different goals with what we're trying to accomplish. So it's really about offering the right intervention at the right time in the right way to make the biggest impact.
Yeah, and that's certainly something that can be done in just about any size of an organization. Now, what I want to dig into here is, okay, these are nice things. We're talking about these as if they're perks now for the employees, and that's great to be a nice guy, a boss or employer to offer this. But let's talk about the nuts and bolts. Maybe 20 years ago, it was a matter of, do we want to be nice and supply this type of environment or build this kind of culture? But now there's hard data that shows that the companies can benefit just as much, if not more, from providing these types of options and creating this culture. As much as it affects the employees, the actual companies, the profit, the bottom line can be affected because of the outcomes that this provides. Let's talk about that and talk about the real benefits to the company and the return. More than just goodwill, there's actual financial return for them implementing something like this.
Sure. And I think that's part of what has been the trend over time is that now that there's more data and research available, employers are getting a little more aggressive. They're getting a little more encouraging and at the same time highly incentivizing their populations to participate in these kind of programs, because what they're seeing is, one study that we've done is just showing that even just moderate exercise, moderate activity for the population can save an employer about 20% in their healthcare costs versus those employees that don't move as much, right? So it's just a very significant opportunity for employers to save not only on their healthcare spend, but also when it comes to increased productivity, reduced absenteeism, increased morale. So the healthcare cost is one part of it, but that's only about 25% of the total opportunity for savings. And there's a lot of different things that are impacted when an employee feels great and takes care of themselves. I think you and I both know if we feel great, we show up, we do a much better job, we're much higher performing employees than when we don't feel well, when we are not taking care of ourselves. So it's a really exciting opportunity for employers to really dive in and be kind of aggressive and create a comprehensive opportunity for their population to create a better lifestyle.
Yeah, well, you talk about that, about the nutrition, how people feel. So a lot of people think, well, okay, what's important for my service type employees to be healthy, right? The people that they're moving things, picking up things, moving things, physical activities. But, we're living in a world and an economy where, the ideas and intellectual property and strategy is what really, kind of feeds the economy and feeds commerce. And when you talk about a culture of health, a lot of people immediately go to fitness, right?
Right.
But a lot of what you do also is fitness of the mind. And we're not talking about kind of, spirituality type things. We're talking about hard science about the way people feel based on what they've eaten and what they've done. Can you talk a little bit about that, about, not necessarily just the physical aspect of it, but the what's happening with people that are in positions of making decisions and strategies, and the clarity that comes with this, and what they've seen the effects and return on that part of it.
Absolutely. So what's interesting is that when we think about just the physical costs of poor health, right? So maybe we have someone that is overweight, they've got high blood pressure, high cholesterol, elevated triglycerides, and their glucose is out of whack. So they're like borderline diabetic, for example. Those people cost about $3,200 in excess claims costs per year. But what's interesting is that the people that have poor stress coping skills and poor life satisfaction and maybe a decrease in social connection, they feel isolated, those people cost about $4,800 a year in excess costs. So what's interesting is focusing these programs not just on the physical part, but also on that stress coping and all of those things that kind of create this psychological cluster of risk for an employee. It's a hybrid. It's got to be a combination. And so a lot of times what we do is work with, meditation or some kind of stress management skills that can teach employees how to manage their stress. So that way they don't go to the Cheetos, or they don't go to go back to smoking when they have a stressful life event. So it's really a combination in the total well-being approach that's going to be the most impactful for long term.
Yeah, and that's just absolutely remarkable. And that's something that I think, obviously you benefit from being in this industry for 20 years is to have access to the data and actually getting to be able to put the hard numbers and, to a granular way that you just did of, this costs this much and this costs this much. And these aren't numbers that you're pulling out of the air. These are numbers that, the people on the other side, the people that actually put together the health plans, the insurance companies, are agree with. Have you seen where the healthcare, the people that manage the plans and the insurance companies are actually seeing and favoring these types of plans within companies when they see a company that has this type of culture of health implemented, that they get any kind of favor as far as treatment in the plans or adjusted premiums or any kind of financial benefits to that?
Yeah, a lot of the health plans now are offering some incentives or some dollars that can be allocated to a health management program and intervention. So that's relatively new, actually, in the industry within the last 3 to 5 years. That's become more and more common that a health plan will recognize, hey, you're doing all the right things. We're going to incentivize you in these certain different ways. So, yes, I think that's only going to increase, actually, because, it just makes sense. If an employer is putting in these types of interventions, their risk is going to be lower and their outcomes are going to be better. So I think we'll continue to see that trend increase as health plans understand the impact that these are having.
Well, I think one of the things which is, proof is in the results, is the people that you work with, the companies you work with. You have a very high retention rate with the clients that you work with, which, obviously something is working here. And I've seen companies that have gone the route of, well, let's have a health fair and we can bring in vendors and talk about, these people talk about yoga, these people talk about the chiropractic, these people, and they feel like, okay, we're on the right path. And what have you seen the companies, when you talk to them and show them what they're doing, which is obviously a good step, but in the difference between what they're doing and what could be done, what's the reaction of this? And then when they actually see the results, how long does it take for them to see that, wow, this really paid off. This really is working out.
Right. I think it does definitely depend on how kind of aggressive they are and comprehensive. So, for example, if they just do a biometric screening and get all their employees tested, that's a great start. But then if they don't do anything with that information, they're probably not going to see a lot of result, right? Because there's not going to be any intervention to help support those employees to create a difference before the next time they get screened. So it really has to be a comprehensive strategy that, like I mentioned before, has to start at the top. You have to have the senior level support that comes all the way down through the organization. And so the more elements that they offer, the more successful and the more results they're going to see. So it really, most of the research shows it takes, 2 to 3 years. After that third year, you can really start to see, because we didn't get this unhealthy overnight, right? So it takes time to create that change. So typically after about the third year is when they're able to see some real outcomes and results of the interventions that they're offering. Yeah, it's exciting.
And that's, on the broad stroke of it. But, I've, seen and heard of how when someone starts to introduce these things, they're like on the first round, they've had employees, they've saved lives just because of something that came up because of this, that they introduced. Something as simple as like you're talking about, the screenings are checking for, I'm not sure the technical terms, doing the blood work or the biometric or, what kind of stories have you seen or heard? Because it's been remarkable to me that, okay, let's try this. And then the first, month, the first 2 months, it's like, wow, this person discovered this because of what we've implemented that's actually saved their life or definitely changed their lives.
Yeah, I love those stories. And actually, I just heard one yesterday. I was at a lunch meeting here at an industry event, and one of the speakers was sharing a story about an on-site clinic. They put an on-site clinic near a large employer here in Dallas, and they put a clinic on site so that way their employees, if they, minor things, cough, sneeze, whatever it is, needed to have attention, or all the way through they had a pharmacy on site, and a lot of different things are available there. He was telling a story. They'd only had the clinic open for about 3 weeks, and 2 weeks in, this employee shows up to work and complaining of chest pain. But, he's, 45-year-old guy, tough, not interested in really going to the doctor. And his coworkers finally talked him into going down to the clinic to get checked. They immediately took him to the emergency room, and he had 3 stents put in. So,
wow.
You do hear stories like that. And he's like, those are hard things to capture as far as the cost or the ROI on that. But they saved one of their employees' lives 2 weeks into the clinic. So that happens a lot, and typically there is something like that in each of the employer populations that we work with, and we call it the bright lights. Like, okay, we got one, we saved one, or whatever it is, and that's a really exciting part of this work and why we do it.
It is. And it's, one of the reasons I can consider you an influencer, because it's not just about, here's a program, here's a menu. really has changed the lives of, not just your clients, but obviously their employees and has gone on to affect the families of these employees. So you have a far reach, when you're doing this. And so when someone comes to you to put this together, one of the things I think is really important is, you're not pulling kind of, pop nutrition out of the air. No, don't eat carbs. No, do eat carbs. Don't eat this. You've done some pretty intense studying over the years and I want to make sure that we don't gloss over it, but it's not something that you've just kind of do and help with the paperwork and let's put this here and implement this here. You're a certified, in all different types of health in nutrition, you have advanced degrees in health management and you've really dug deep, not just in the physical part, but in the nutrition part. So you understand the principles of what's going on here and not just kind of what the latest thing is in the latest health magazine, and I'm sure a lot of people, they have those opinions. Oh, well, we'll just take some of the potatoes out of the cafeteria and we'll be good, right?
It's not that easy. So, yeah, but, and also working with a lot of clients. I've worked with over 200 plus, large employers, helping them create a strategy and really refine and understand what works, what doesn't work. And so now I'm able to bring that experience to my clients and say, hey, well, I've tried a lot of things and some things work and some things don't. And these are the best practices. And this is what we want to implement for your population because we know what works now, which is exciting too.
Yeah, well, it is very exciting. And I think that really, kind of defines that culture of health isn't just a catchphrase. It really is a culture of health. It's not just about, the exercise. It's not just about nutrition. It's just not about personal well-being. It's about how it affects corporate culture. It's about how it affects the bottom line and profits and the way people work, not just independently, but together. And, it really makes a huge difference in, a company's general culture, which I think is absolutely remarkable. How can people find out more about Hayley Hines and what you're doing and learn more and go deeper about creating this culture of health?
Sure. They can find me at my website at HayleyHines.com.
HayleyHines.com. Definitely, check this out. If you have a company of just about any size, and if you work for a company about just any size, this is something that really is, innovative, and it's something that not only benefits the employees, but it benefits the employer, and it really is a win-win situation. And in the case of affecting the people even beyond with families, and it's a win-win-win. And I love the triple win situations. So, Hayley Hines, thank you so much for coming on to Influencers Radio today and sharing this.
Thanks, Jack. I appreciate it.
All right, folks, there you have it. Check it out. We'll have a link right here on the show post. And until next time on Influencers Radio, remember, you are the only real game changer.
You've been listening to Influencers Radio. To get all past shows and updates on future shows, visit influencersradio.com today or follow us on Facebook at facebook.com/influencersradio.